A 70 years old lady who never smoked is identified as having peripherally seated mass in her left lung. What is the most likely underlying diagnosis? That means a female never smoke. So which type of cancer? That means the lung cancer which is not relating to the smoking. Here the options are small cell cancer, lung cancer, gastric cancer metastasis, adenocarcinoma, squamous cell carcinoma, and lymphoma. So first of all, let's see the different type of the carcinoma. First of all, this is the small cell cancer. The small cell carcinoma, they usually arises from the neuroendocrine differentiation or from the neuroendocrine cell. So a small cell lung carcinoma, they arises from the neuroendocrine differentiation. Neuroendocrine hormone may be released from this cell, and wide range of paraneoplastic association present. What is paraneoplastic association or paraneoplastic syndrome? That means the cancer in the lungs, but this lung carcinoma, it secretes definitive type of the hormone or peptide, and it acts other organ in our body, such as the lung cancer patient develop polyuria. That means it secretes definite type of hormone which is causes the polyuria of the patient. Tumor are strongly associated with the smoking. Small S for S. That means small cell carcinoma, smoking. Typically arises from the large airways and they disseminate early. So a small cell carcinoma, it's looking like a small, but it is not a small. It is really disaster for the patient, because the small cell cancer, it disseminated very early, and when diagnosis, it is the metastatic phase, and it occurs in the large airways, and it is associated with smoking. That means S for S. Now the non-small cell cancer, these are the common feature of the prognosis and management. And the non-small cell cancers, they are the squamous cell carcinoma, which is 25%, adenocarcinoma, and large cell carcinoma. Paraneoplastic feature and early dissemination are less. So the non-small cell cancer, they are typically, they are better than that of the small cell cancer. All cancer are really bad, but the non-small cell cancer is relatively better than that of the small cell cancer. Adenocarcinoma is the most common lung cancer encountered never a smoker. So we know lung cancer are usually associated with the smoking, but adenocarcinoma of the lungs, it is not associated with the smoking. Now see, the adenocarcinoma has most common tumor present never smoker, and they usually present in the periphery. Lung cancer may be classified according to histological subtype. Non-small cell lung cancer is the most common variant and accounts for 80% of the cancer. So it is beauty of the Almighty Allah that the cancer which is the most severe, this usually less percentage, and the cancer whose prognosis is better, usually they are more percentage. So the non-small cell cancer, it is the less severe, and it present 80% of the all lung cancer, and only 20% of the lung cancer as the small cell cancer, which is dangerous. So the never smoked cancer which is peripherally seated, it is the adenocarcinoma, and the small cell cancer, it is S for S, and also the squamous cell cancer, it is S for S. That means the smoking, squamous, smoking, small cell cancer. I think it is very, very clear that smoking S and S for S, smoking, small cell cancer, squamous cell cancer. And what happened? Let's see in short that first of all trachea, then bronchi, then lungs. So what happened when smoking? The smoke particle usually present in the large airway, then goes to the smaller airway. So there is the more irritant in the larger airway. As the more irritant in the larger airway, so a smoking related cancer, they occurs in the larger airway. Is it okay? I think okay.